You know what fascinates me, Dr. Esma? Most people sit in a dental chair every year, hear a few technical words, nod politely, and leave without ever knowing the real story behind their treatment. Today, we are flipping the script. Instead of dentist to patient, it's dentist to dentist. And honestly, I have a feeling some of these truths might surprise people watching right now. For example, how many treatments that sound complicated are actually simple, and how many simple problems quietly grow into something much bigger. Stay with us, because in the next few minutes, we're opening the curtain on the things dental professionals discuss among themselves but patients almost never hear. Dr. Esma, are you ready to reveal a few secrets?
Razim, I'm ready, but I have to warn everyone watching. Once you hear these behind-the-scenes realities, the way you think about dental visits might change forever. Dentists talk to each other very differently than we talk to patients. Not because we hide things, but because the conversations become more detailed, more honest about risks, timing, and long-term outcomes. Sometimes the biggest difference between a small procedure and a complex one is simply when someone decides to visit the clinic. And sometimes the questions patients never ask are exactly the ones that matter most.
Let me paint a familiar picture, Dr. Esma. Someone feels a tiny sensitivity when drinking something cold. Nothing dramatic, just a quick zing in the tooth. So what do? They ignore it. Weeks pass, months pass, and suddenly one day that same tooth wakes them up at night with real pain. And now the question becomes, how did something so small turn into something so serious? I hear stories like this constantly. People say, it was fine yesterday. But dentists know the truth, right? Problems inside a tooth don't usually explode overnight. They quietly grow while life gets busy. Work, family, errands, and dental checkups slowly move down the priority list.
Exactly, Rasim. From the dentist's perspective, we often see the timeline very differently. A patient may remember the pain starting yesterday, but the underlying problem may have been developing quietly for months, or even longer. Tiny enamel wear, a small cavity forming between teeth, or early gum irritation. These stages are usually painless at first. That is why regular visits matter so much. When dentists talk to each other, we often say the same thing. The easiest treatments are almost invisible because they happen early. The complicated ones appear when the early signs were easy to miss.
So what you are saying, Dr. Esma, is that the real story of a dental problem usually starts long before the patient notices anything. That is fascinating because most people judge their teeth based on one simple rule. If nothing hurts, everything must be fine. But dentists clearly see a different picture. A tiny crack, a barely visible cavity, or early gum irritation might look harmless today, yet months later, it can turn into something that requires much more serious care. And that is the moment patients often say the famous line, "I wish I had known earlier." It makes you realize that dental health is a bit like maintenance on a car. Ignore a small warning light long enough, and suddenly the repair becomes much bigger than expected.
That comparison is actually very accurate, Rasim. Let me give a simple example dentists discuss often. Imagine a very small cavity detected early. Treating it at that stage may only involve a quick restoration, and the tooth remains strong. But if the same cavity quietly grows deeper, bacteria eventually reach the inner nerve of the tooth. Now the situation changes completely. What started as a minor repair can evolve into a far more complex procedure. This is why dentists emphasize early attention. The earlier we see something, the more conservative the treatment usually is.
Dr. Esma, I once heard a statistic that really made me pause. Many adults actually wait until discomfort becomes obvious before scheduling a dental visit. That means the appointment is no longer preventive, it becomes reactive. And when that happens, the dentist is no longer dealing with the beginning of the story, but the middle or even the final chapter. Imagine discovering a small roof leak only after water starts dripping into the living room. The problem did not start that day, it simply became impossible to ignore. I think this is where the gap between what patients feel and what dentists know becomes very interesting.
That is a great way to describe it, Rasim. Let me share a quick example from everyday practice. A patient may come in saying the tooth only started bothering them a few days ago. But when we examine the area and review images, we sometimes see signs that the cavity has been slowly progressing for quite some time. From the patient's perspective, the problem feels sudden, yet biologically, the process was gradual. Teeth rarely change overnight. What changes overnight is awareness.
Dr. Esma, this is where my curiosity really kicks in. Because when people think about teeth, they often imagine them as static objects, almost like tiny stones in the mouth. But science tells a completely different story, right? Teeth are living structures connected to nerves, blood supply, and surrounded by tissue that constantly responds to bacteria, food, and daily habits. So when a dentist looks at a tooth, they are not just seeing enamel. They are seeing biology in motion. And I suspect that is why dentists sometimes notice patterns long before a patient ever feels something unusual.
Exactly, Rasim. From a scientific perspective, the mouth is an ecosystem. Hundreds of bacterial species interact with saliva, diet, and oral hygiene habits every single day. When the balance stays stable, teeth and gums remain healthy. But when that balance shifts, small changes can start to appear. Demineralization in enamel, early gum inflammation, or microscopic plaque accumulation. These processes begin long before visible damage occurs.
Alright, Dr. Esma, if someone watching right now is thinking, okay, I get it, small issues grow quietly, the obvious question becomes, what should a person actually do differently starting today? Because most people are not dental experts. They do not look at a tooth and instantly know whether something is normal or the beginning of a problem. So if we break this down dentist to dentist style, what are the practical steps? Imagine someone who wants to stay ahead of problems instead of reacting to them later. Where does that process really begin?
Great question, Rasim. Dentists usually think in a simple sequence. Step 1 is awareness. Pay attention to small signals such as sensitivity, gum tenderness, or food getting stuck more often in one spot. Step 2 is routine prevention. Consistent brushing, cleaning between teeth, and balanced habits that reduce plaque buildup. Step 3 is professional evaluation, because dentists can detect changes that are invisible to the eye. And step 4 is early correction. When something is discovered early, treatment is usually simpler and more conservative.
Dr. Esma, I think this is the moment where people really want clear guidance. Because the internet is full of quick fixes, miracle toothpaste claims, and advice that sounds convincing but may not actually help. Someone feels a little sensitivity, and suddenly they are reading 10 different opinions online. Some say ignore it, others say change toothpaste, and a few say it could be something serious. That can be confusing. So if we simplify things dentist to dentist style, what are the most important do and do not rules people should remember before a small dental concern quietly turns into a bigger situation?
Great point, Razim. One important caution is not to ignore recurring signs. If sensitivity appears repeatedly in the same tooth, that is worth checking. Another is avoiding aggressive brushing. Many people think brushing harder cleans better, but it can actually wear enamel and irritate gums. A helpful habit is consistency, gentle brushing, cleaning between teeth, and balanced daily routines. And perhaps the most important reminder is simple. If something feels unusual for more than a short period, it is wise to have a professional look at it.